86% of organizations value professionals that upskill to advance their careers. It's never too late. Enroll for a self-paced online course to begin upskilling in monitoring, evaluation, accountability and learning, water, sanitation and hygiene, disaster risk reduction and management, food security and nutrition in emergencies, procurement and supply chain management, human nutrition and dietetics, maternal and infant young child nutrition. Apply today to enjoy a 10% discount.
Hello, everyone, once again. Good morning, good afternoon, good evening, based on where you're joining us from. And welcome to today's webinar hosted by Humanitarian Global. The topic for today is role of WASH in combating diseases and the emerging trends in the humanitarian sector. We do apologize, as for today, we do not have our expert, our keynote speaker, Vincent, with us. However, we do have an expert in the WASH health field, Rose Kandago, who has actually been an expert speaker in a lot of our webinars. To begin with, I will start with a few house rules before I introduce the team to say hello to everyone. House rule number one is kindly make good use of the chat section. You can chat with us. We are very responsive when it comes to chats. In case if you're facing any technical issue, you can also let us know via the chat. We'll be able to assist you. Also, do let us know in case if you're interested in any of the courses. We have shared a link on the WASH courses. You can share with us your details. You can share with us your phone number, as well as your email address, and our team will be able to reach out to you. Remember, when you chat with us, no one else but the panelists are able to see the chats. So we do protect your data privacy. No one else is able to see your details when you do share with us. So we do encourage you to share with us your phone number as well as your email, and our team will be able to reach out to you with more information on Humanitarian Global, as well as the courses that we do offer. House rule number two is at the very end of Rose's presentation, we will have a Q&A session. And during this Q&A session, we will ask a few participants to raise their hands, and we'll allow them to ask questions during the webinar live on the webinar. So kindly refrain from raising your hand. If you do have a question or an issue, do share it in the chat section. House rule number three is make good use of the Q&A section. Today's webinar's topic, as I've talked about, touches on WASH in combating diseases. So if you do have a question, Rose will be able to address them at the end of her presentation. And during the presentation, kindly direct your questions to the Q&A section, and we'll also be able to respond to them. So those are the three main house rules. We kindly request that you adhere to. So with me, I do have a big team here with us from Humanitarian Global, and I will be welcoming them just to say hello to everyone. I'll start with myself. My name is Diana. I am the Academics and Training Coordinator here at Humanitarian Global and the moderator for today's session, and I do welcome everyone to today's session. With me, I do have Sheila. Sheila, you can say hello to the team.
Hi, everyone. As you've heard, my name is Sheila. I'm the Academic Registrar at Humanitarian Global, and I do look forward to great interaction amongst us.
Thank you so much, Sheila. We also have our speaker for the day, Rose Kandago. I'll invite her to say hello and introduce herself before we proceed to the next segment. Rose, welcome.
Thank you so much, Diana. Thank you so much, Sheila. So my name is Rose Kandago. I'll be your speaker for the day. Thank you so much. And over to you, Diana.
Thank you so much, Rose, for that. We also do have another team, the technical team that is behind the webinar for today, and that are actually very active in responding to the chat section. And on behalf of all of them, I do send salutations and greetings to all the attendees of this webinar. So before I bring in Rose, remember today's webinar is is a WASH related webinar, WASH and public health. And with that, I'd like to just touch on a little bit that Rose will be talking on before I bring her on board. And this is in regards to the WASH courses that Humanitarian Global does offer. So here at Humanitarian Global, we do have water, sanitation, and hygiene WASH, that is courses that we do offer to our participants. And this is under the SDG 6, clean water and sanitation for all. And in this area, we do offer diplomas, certificates as well as postgraduate diplomas. We also have other related areas when it comes to WASH, and this includes menstrual hygiene management and social and behavior change communication, short courses. These are short courses. These are courses that you do get a certificate at the end of undertaking this course. For now, I'd like to focus on social and behavior change communication, SBCC in short. So who is this course for? This course is for anyone in the humanitarian development aid field, anyone who works in an NGO, is a civil servant, even works in private practice, because remember, there is the communication aspect of it, and every organization, every government institution, every international organization requires for us to have communication skills. And why social and behavior change? This is because, remember, communication is directed at either changing the norms, attitudes, beliefs, and behaviors of individuals. So when you're communicating, that is your primary objective of communication. And under WASH, not just WASH, but in other programs as well, it could be in health as well, health communication, we do have SBCC. And what is SBCC? SBCC is a way of communicating specific messages to a targeted audience, like I did mention, in order to influence their behavioral change in their attitudes, norms, and beliefs. So this also includes cultural and religious practices as well. And when you undertake this course with us, you understand how to prepare targeted messaging, how to prepare creative briefs, how to prepare as well as communication, outreach messaging, and the kind of targeted audience that you will be interacting with. You do get to understand how to the different channels that you use in terms of creating this messaging. And not only that, you also get to understand how to disseminate and implement these SBCC programs and messaging, as well as how to evaluate and report on this kind of messaging. So it is a very progressive way of learning, where we start from the very beginning with the introduction, the definition, the strategies, the principles of SBCC, and then we then go building up on those skills to now actually understanding the people that you want to communicate the targeted messaging to, as well as creating the messaging. We use the C planning process of creating this messaging. And at the very end, you learn also how to implement, monitor, evaluate, report, and even the feedback systems that you do use in this kind of messaging. I really do encourage our participants to take up this course. This course is offered by Humanitarian Global via a virtual classroom. This is through Zoom. And by virtual classroom, I mean it is interacting with a trainer one-on-one. It is interacting with your fellow participants. So you feel like you're in a classroom as much as it's virtual. The reason behind it also being virtual is, remember, we are joining from all over the world. We get to interact with several participants from different professionals, from different countries, from different continents as well. And that is why this is virtual. The other reason for us offering this course virtually is because, you know, rather than us sending you the materials for you to read on your own, you get to go step by step through creating messaging, through understanding what SBCC is, even through the monitoring and evaluation process of SBCC with the trainer. That way, no one is left behind, no one lags behind in the classroom. Everyone is at par. So I do encourage you to register for this course today. It goes for 250. And to register for the course, kindly just click on apply now, and you will receive a form. You will be directed to a form such as what I'm showing on my screen. Fill in your details and submit. And once you click submit, one of our team members will be able to reach out to you and will be able to assist you through the final registration process. With that, like I did talk about, there's a lot of other WASH courses that we do offer, from certificate to diploma to postgraduate diploma. We've also shared the link on that in the chat section. Kindly, if you're also interested, you can click on that link and it will direct you to this page. Alternatively, you can share your details with us and we'll be able to reach out to you. You can even go a step further and tell us, my name is Diana, my phone number is ABCD, my email address is this, and I am interested in undertaking the SBCC course, and we'll be able to assist you. So this course is starting on the 15th of August, that is next week, and we usually take in a number of approximately 10, and it's first come, first serve. Remember, we are doing this as a virtual classroom, and the reason why we are taking just a number of 10 is so that we can be able to all understand, all get the skills that are going to be impacted on us by the Humanitarian Global team. Having said that, now we can move on to today's topic, role of WASH in combating diseases, emerging trends in the humanitarian sector. And like I did introduce our expert for the day, who is Rose Kandago. At this point, I do welcome her to take over the session. Rose, the floor is yours.
Thank you so much, Diana, and thank you so much, everyone, for joining in today. I hope I'm audible enough. So please allow me to share my screen so that we can proceed. Okay, sure. Thank you so much, everyone. So for our session today, we'll be talking about the role of WASH in combating diseases. And specifically, I will be looking at outbreaks, like diseases that arise due to outbreaks. I will be also looking at some other diseases really that role has a very critical a critical role in terms of prevention. Okay, so as I said, this is what our agenda will be today. First of all, we will look at the current JMP data that were released recently, looking at the status of WASH indicators really globally. We'll then look at some of the diseases that are related to WASH or they are associated with WASH. And then we will have also a look into the role of WASH in disease outbreaks. What are some of the interventions really that are focused on WASH that are related to disease outbreaks. We'll also look at the role of WASH in preventing HAI and AMR. So HAI, it is hospital-acquired infections, and AMR is antimicrobial resistance. And then we'll also have a look at the role of WASH in combating NTDs. NTDs are neglected tropical diseases. And then finally, we will have a short also session looking at the role of WASH in prevention of COVID-19. So this is how I've structured our webinar today, and I believe we'll have a good conversation. I believe all of us have come across the current data from JMP. They have published new data on WASH indicators, and some of the first facts that I picked from the indicators, looking at the three different areas that we focus on water supply, on sanitation, and on hygiene, is that we have around 2 billion people who still lack access to safely managed drinking water at home. So I looked at the highest level that looks at safely managed, because we have the different service ladders. But I picked on the data that looked at the safely managed drinking water levels, is that we still have around 2 billion people really globally who still lack access to safely managed drinking water. So when we talk about safely managed drinking water, we're looking at water that's accessible on the premise or within the households. It's also water that is available in need. So, and also water that is free from contamination. So when we look at those three key three components in terms of safely managed drinking water at home, so we still have a long way to go. So in terms of sanitation, we still have around 3.6 billion people, which is nearly almost half of the world's population that do not have access to safely manage sanitation. And among these 3.6, we have around 494 million people who still practice open defecation. And on the hygiene ladder, we still have around 2.3 billion people who still lack basic hygiene services. Here we are looking at the presence of hand washing facility which has soap and water at home at any particular time. So among these 2.3 billion people, this includes around 670 million people who have no hand washing facilities at all. So even as we are moving towards SDG, as we're moving towards the target of 2030. So we have around 7 years to 2030, and we still have a long way to go. So we still have a lot to do in terms of really improving some of the wash services. So even as we are looking at this data, we look at this data in terms of if we still have so many people who still have lack of access, and then now we can relate to some of the diseases really that we would want to combat by using the wash approach. So let's briefly look at diseases and death. I did not pick, I picked just quite a number of diseases, but they still have quite a number. We still have so many diseases that we can really pick in terms of what is the morbidity and mortality that arises as a result of some of these diseases. But I picked what I know, what I think is really important for us, particularly for diarrhea among children who are younger than 5 years of age. So as of 2018, in one of the publications by Lancet, they estimated around 1.7 billion cases of diarrhea among children every year. This still are really quite a large number. So in terms also of children that die from diarrhea in LMIC, that is low and middle income countries, it's estimated that around 446,000 children. So cumulatively, this is the contribution to the death really is around 9% of deaths of children under 5 years. So in terms of cholera is one of the key diseases. Even currently, most of the countries really are grappling with the episodes of cholera. With episodes of cholera really at the moment, which is as a result of they've been maybe drought, and then we have so much floodings in maybe several places. So there's been really so many cases of cholera at the moment, and it is estimated around 3 million cases of cholera, and with estimated deaths of around 95,000. And then also there was also a study that looked at the cases for typhoid fever, which typhoid is also one of the wash-related infections. So that study found that there were around 11 million cases of typhoid fever and around 129,000 deaths as a result of typhoid. So this, if you look at these diseases, these are really wash-related diseases, and we can even, if we had time, we can even look more even to other diseases. But it's just a snapshot to really tell us the burden that we have in terms of diseases that are related to wash. Okay, so for this slide, really, this is just a snapshot of some of the diseases that are related to wash, and most of them really are fecal-oral. So, and the common one really is diarrhea and maybe cholera, I think. And then also we have other infections also, maybe like skin and eye infections. And I think also we have roundworms, we have hookworms, which are related to excreta. We have some of also diseases that I would call the neglected tropical diseases, and these are mostly the water-based, the schistosomiasis, the guinea worms, the clonogenesis, really they are really more related to neglected tropical diseases. And I think this is one of, we will be able to discuss this one more. Also, we have malaria, dengue fever, all these diseases that are related to mosquito bites or sometimes transmitted by flies and maybe other insects. These have also been associated to water and sanitation related. So there are quite a number of diseases really that are related to wash, and that's why there's need really to see how can wash really improve or really support, or really how can really wash programs really come in terms of prevention and control of some of these diseases. Okay, so after looking at all this, really, what is fundamental and what's important is that access to water, sanitation, and hygiene is fundamental to health, and that wash really plays a critical role in prevention and management of diseases. And the key thing here is that it limits or breaks the transmission cycles. I believe all of us know about the F's that we usually talk about. And if you look at it critically, really, you realize that really WASH has a critical role in terms of how to prevent and also managing some of these diseases that we have just highlighted. Okay, so I picked a definition from WHO because I was trying to think about disease outbreaks. Sometimes we hear about malaria outbreak, we hear about dengue outbreak, we hear about cholera outbreak, but what really is a disease outbreaks? So this is a definition that I picked from the World Health Organization, where they define that an outbreak is the occurrence of cases of diseases in excess of what would be normally expected. So in a defined community, usually we have maybe the number of malaria cases at a given time in a community. But when we want to talk about an outbreak, it means that we are having more cases than what is normally expected. So sometimes outbreaks are restricted to a geographical area. Sometimes it even extends to several countries. So sometimes, for example, you can have maybe within a country, maybe in a certain region, but sometimes you may find that it's even going beyond another country. So outbreaks sometimes can be within a geographical area, and sometimes it can go even beyond countries. Sometimes also outbreaks also can last for a few days or weeks or even several years. So sometimes you may find that it's a cholera outbreak, but after maybe a few weeks, it's controlled. But sometimes you may find that an outbreak can last for days, sometimes can last for weeks, and also sometimes can even last for years. So disease outbreaks really are really dependent on the context and also depending also on geographical area. But the key thing here is that that an outbreaks usually occur in when the cases of a disease are in an excess of what would normally be expected. So what we want to look now is what is the role of WASH in controlling maybe disease outbreaks. So when in terms of interventions, so there are many outbreak responses usually for diseases, and the interventions usually cover several sectors. So we usually have the medical, that is usually the clinical part. We have the public health. We have sometimes the engineering aspects. And sometimes also we have preventive vaccines. For example, the OCVs, the oral cholera vaccines, for example. We have even currently maybe the malaria vaccines. Also, those ones also are some of the interventions for response. And sometimes we have medications for some maybe common health focused outbreaks. So outbreak strategies are it covers a lot of sectors. But for our purpose, for our discussion today, we'll be focusing on the WASH. So WASH interventions and the key aim is really to prevent the uncontrolled waterborne and communicable diseases. So specifically, it's about WASH coverage and provision of what really prevents what is caused by disease agents, maybe for example, cholera. So also WASH interventions assist the providers and responders in controlling the spread of the diseases in treatment facilities and in communities. And this is one of the aspects we'll also be discussing more, where we look at interventions really that are related to health facilities or treatment centers. And also we'll also look at interventions that are basically focusing on the communities or households. So in terms of outbreak responses, we have so many interventions, but for today, we'll just focus on some of the key interventions can be done in WASH relating to outbreak response. So the first one, next. So the first one on the key interventions, the first one is on water supply. So in water supply, in a response, yes. So the first response or intervention category I'll talk about is increasing access to water. So oftentimes, let's pick, for example, we are looking at cholera. So during cholera, one of the key things is about provision of potable water to communities. So one of the key things in terms of water supplies is increasing water access to communities. So when you provide water access, it is one of the necessary steps in providing potable water. And one of the key activities really is about rehabilitation of strategic water points. So this one is not about constructing new water systems, it's about rehabilitating existing water systems. And another intervention is on water tracking. So you'd find in communities that are water stressed or who are experiencing an outbreak, we do what we call water tracking or water tankering. So the key thing is about how do we ensure that we are improving water access to communities during outbreaks. Apart from increasing water access, we also look at we call what source-based water treatment options. So this one is about improving the quality of water. So you'd find, for example, during an outbreak or a response, you find like most communities do not have access to safe water. So that's where now we come in and provide what we call source-based water treatment options. And the common one is where we provide what we call chlorine dispensers. So chlorine dispensers, this is just an example, which are dispensers that are placed strategically near water points so that when people collect water, they're able to access chlorine dispensers within, usually at the water points. So they're able to treat their water during collection. So this is at the source. So it is one of the ways to ensure that you're providing water quality during an outbreak. So the third one is about household water-based treatment options. So this one now is at the household level. What we talked about earlier is on the source. At the source where people are getting water, it should be able to be safe. So this one now is about household water treatment technologies, where we usually ensure that people are having access to water which of appropriate quality. So this one is where we do distribution of water purification tablets to households, where now we work maybe, for example, with community health volunteers and also maybe community health promoters to ensure that households are accessing water treatment options. The next component, which is very key, is on hygiene promotion. This is one of the core areas of WASH to ensure that personal hygiene during outbreaks is done, to ensure that we are trying to control the spread of diseases. So hygiene promotion is one of the areas of interventions where to ensure that disease outbreaks really are controlled. Another key element in terms of WASH is on distribution of NFIs or non-food items. And this really varies, and there usually a number of items that are usually in a kit, but this has been shown also is a way of ensuring that it's a way of also responding in terms of outbreaks, particularly outbreaks that are related to WASH and for diseases, for example, like increase in diarrheal cases or cholera or typhoid and the rest. So hygiene kits are usually one of the ways also to ensure that we are supporting households and families also to ensure that they are having access to safe hygiene practices. The other component is on the environment. So the next component is on the environment. So for example, if, next slide, please. So the other one is on the environment and environmental hygiene interventions. So wherever there is an outbreak, we don't just focus on the households, we also focus on the environment where communities reside. So it could be the household, it could be the schools, or it could be the market. So this one, what it means is that we are trying to also to break the cycle of transmission, which is within the environment. So sometimes you find maybe maybe garbage collection. You'd find maybe, for example, about environmental modifications. For example, maybe it is malaria in terms of malaria control. So maybe about spraying and all that. So it's also, this one also focuses not just within the households, but it looks beyond the larger environment. So the other one also is in terms of installation of temporary or permanent sanitation facilities. This is also a key intervention because of the management of fecal waste, which is very fundamental in ensuring that we minimize the spread of fecal-oral diseases. So the next now we would want to look at, I talked about, we have WASH, the role of WASH and antimicrobial resistance. I'll be able to define these two components in the next slide, but just for our information is that it has been shown that about 10% really of infections really occur within the facilities, and that this means that 1 in 10 patients get an infection while receiving care. And then about 50% of surgical infections can be antibiotic resistant. And I will be able to explain about AMR. and that if we have what we call effective IPC, that is infection prevention control strategies, is able to reduce about 70% infections. So essentially IPC is all about, much of it really is about WASH, that is infection prevention and control, which has been shown that if we improve WASH in healthcare facilities, we should be able to reduce up to 70% of infections. What is HAI? So HAI is healthcare associated infections. So these are infections that are acquired while receiving treatment for another condition in a healthcare setting. It means like maybe if a patient goes to the hospital with a different infection, but they can really get out of that facility with another infection. That's what we call HAIs. And AMR, that's antimicrobial resistance. It is it is whereby you find like microorganisms are becoming resistant to the drugs, the original drugs that was effective for their treatment. So I'll be able to explain more about AMR in the next slide. So you'd find that usually healthcare workers sometimes get also in contact, for example, by potential harmful microbes, yeah, from different sources during the just the daily care of patients, and sometimes this also may cause outbreaks, and sometimes also they become resistant to antibiotics. So what we call poor IPC, what I call infection prevention control practices, and sometimes the unsanitary conditions in healthcare facilities contribute. We can now look at, just a minute. So one of the key things is really about hand hygiene, which has been shown that it can really stop the spread of microbes and can protect patients and staff. So this is what I was talking about in terms of what is AMR. So AMR, in just a brief, is when bacteria, viruses, fungi, and parasites change over time, and they no longer respond to medicines, making infections harder to treat. And it increases the risk of disease spread, severe illness, and death. That is what we call AMR. And why does it occur in healthcare facilities? Is because one of the key things, there are other factors really, but one of the key things that has been shown that contribute to the increase of AMR is lack of access to WASH, especially sanitation, poor infection prevention, and also lack of awareness and knowledge, or over or misuse of antimicrobials. But the bottom line here is that it has been shown that one of the ways really on preventing antimicrobial resistance is the improvement of WASH situations in healthcare facilities. So that just a photo or just clip or just a photo that is giving a summary on the causes of antimicrobial resistance. And the main one is really lack of hygiene and poor sanitation, poor infection control in hospitals and clinics. So what does this tell us? It tells us that we have a big role or a major role really in terms of how we can prevent AHIs and AMRs in our facilities. So lack of safe water and functional toilets in healthcare facilities is what is really posing the significant health risks, not just to patients, but also to healthcare workers and also to their adjacent communities. And hand hygiene really has been cited as one of the single most important practice to reduce HAI. And so the key thing is that if we improve hand hygiene practices, we are able to decrease the incidence of AMRs in our healthcare facilities. Now let's talk about the role of WASH, or this is just a summary of really some of the mutual benefits of adequate WASH in healthcare facilities, which I will not really belabor myself so much in this. But let's move and talk briefly about WASH. So as I was talking about neglected tropical diseases, so some of the neglected tropical diseases that is becoming an area of focus at the moment is trachoma, schistosomiasis, and guinea worm. And it has been shown that these NTDs such as helminth infections, schistosomiasis, and trachoma cause a significant burden to globally. And in combating these NTDs, there are 5 core strategic interventions that have been established by WHO. And one of them, apart from the chemotherapy, the vector control, and disease management, is the provision of safe water, sanitation, and hygiene and hygiene. So what this tells us is that wash is really key in terms of combating these diseases. So specifically, for example, we can give an example, for example, for trachoma. Trachoma has a strategy of its management where we use what we call the SAFE strategy. So the SAFE strategy, so apart from surgery and all that, one of the key things that really is being promoted is environmental modifications, where we look at the environment and also we look at maybe face washing and also hand washing. So that's where now really wash comes in combating some of these diseases. So if you look through how programs are being designed in terms of how to eliminate some of these diseases, trachoma, schistosomiasis, skinny worms, and the rest, you realize that care wash is really one of the key things that is done to ensure that it is controlled. The last bit is wash and COVID-19. I think this is not even an area that which I know this is an area that every one of us has been really well versed with. And I think WASH was one of the areas that really needed support during, or was one of the areas really that was realized it's one of the key areas really that interventions in WASH really help in improving and also managing COVID-19. And one of them really was the proper hand washing, which was really supported and really, which has been really key in terms of prevention of COVID-19. So in summary, what we can say is that universal access to safe water, adequate sanitation and hygiene has the potential to reduce the global disease burden. So WHO has given us, thank you so much. So according to WHO, really, that if we improve access to safe water, sanitation and hygiene, it has the potential to reduce global disease burden by up to 10%. So this really tells us that there's really much that really WASH can do in terms of reducing the global burden of diseases. Another takeaway home message is that increasing access to safe water and sanitation can prevent many diarrheal diseases. And that a study that was done in 2016 showed that unsafe drinking water and inadequate sanitation contributed about 829 deaths, which is equivalent to about 60% of total diarrheal deaths. So this really also tells us that in improving wash services really has the potential really in terms of reducing some of these deaths. And lastly, is that investing in water and sanitation has many benefits. It goes beyond health. It goes beyond health and it includes economic, environmental, quality of life, and health. It has been shown that every dollar that you invest in wash, it gives us up to about $5 return, really in form of form of returns. So these returns is in form of reduced healthcare costs, reduced pollution of water, and also improved school attendance on generally in terms of quality of life. And I think we'd stop there. But the key message is that there's so much that WASH can do really to ensure that we, in terms of controlling and preventing many of the diseases that we've talked about, that we have like particularly in terms of communicable diseases, but it also looks beyond communicable diseases and it goes even to NTDs, what I've called neglected tropical diseases, and also much of the infections really that happen within our healthcare facilities can be improved and can be reduced really by improving wash interventions in our healthcare facilities and also in other institutions. So it's not just in healthcare facilities, but also in other institutions, even within the schools and within other institutions, really within our spaces that we work in. So thank you so much. I know it's been brief, but just that was just a highlight on really how WASH really can really contribute in combating diseases within our societies. Thank you so much, and over to you, Diana.
Thank you so much, Rose, for that very well put presentation. I believe we have all learned a little bit more about the relationship between WASH and public health. And with that, we come to the Q&A section. So I do welcome participants with questions to kindly raise their hands, and then we'll allow them to unmute and ask their questions. In the meantime, I do have a few questions here from so we'll start with the first one from Carlos. Carlos asks, let me just have a look at Carlos's question. So can you give some insights on how standards in WASH help improve WASH sector as a whole? Over to you, Rose. I'll repeat the question. Can you give some insights on how standards in WASH help improve WASH sector as a whole?
Thank you so much. I think when you talk about standards, it will give us like within the space of WASH. So when we have standards and we all work towards standards, it means that we are achieving really what we require. When we provide standards, it is a measure to help us work towards something. Let me give, for example, when we say, for example, that maybe let me give a basic one. For example, when we say in a school, maybe the number of toilets per like number of pupils, for example, like 30, maybe 20, 25 girls per latrine block. What we mean is that it is a number that should be able to provide a service so that maybe children do not queue, and maybe so that maybe facilities are not overused, and maybe also to ensure that we are providing enough privacy and all that. So when we provide standards across the different sectors and in different maybe for example, when we talk about what is the standard, for example, for water quality. So if you work towards that standard, it means we are able to all of us have the same level, and we are providing a service that we know it at that level, it should be able to provide the best service to the communities. So it's really important for when we talk about standards, the standards cover and it reaches to many, and maybe all, when all of us work towards something. That's why even for the for example, what JMP does, for example, when they give us when they provide the different service levels, it will be able now to tell you where you are, maybe even as an institution or even as a nation, and that if we are all working towards, for example, safely managed. So if we have all our populations really are safely managed, it means now all really are able to get very quality services. So standards are really important in that it provides now a platform where all of us really are working towards something.
Thank you, Rose, for that. We actually do have another question from Carlos, and it's quite a lengthy one, and I will read it out for our participants also to listen in. It's in the chat section. So he says, in Cameroon, due to insufficiency of water supply networks, everyone in town owns water wells, and each person manages only his space and can't influence how their neighbor manages their own space in terms of land use. So he goes on to say, most wells are used for drinking water, but are found to be very polluted as they are close to septics and other discharges. Then asks, how cost effective can we render the water safe, given the costs of completing a complete analysis of water sample is very expensive, and then gives an approximation of 300,000 Cameroonian francs. So how can we render the water safe, given that the water cost of completing this analysis is quite high? And also remember that everyone does have their own water well. However, a lot of them are polluted due to the closeness to septic tanks and other effluents, as well as discharges.
Thank you so much. I know the question is quite lengthy, but I can give my thoughts on that. I think when he talked about, he said that these wells are owned by individuals. So they're not receiving water, if I got it right. So they're not receiving water maybe from a centralized system for water reticulation, maybe from a central system. So if it is individual, if it was from a central system, it means water is treated at source. But now these are from individuals. So now for that one now, because I know he's talking about that we're not able really to determine the quality of water for each of the households. I think that's where now we have the hygiene promotion component coming in. So for hygiene promotion, really it's about educating or raising awareness to the communities really on the need to ensure that the water is safe, bearing in mind the fact that he talks about that some of these wells are located maybe in areas that are maybe adjacent maybe to sewer systems. So this now looks at maybe how can we really enlighten the communities really through maybe hygiene promotion and maybe doing campaigns really on the need to ensure that their water is safe. And then also maybe during those campaigns now, maybe now we can promote the use of what I talked before about household water treatment system, household water treatment, maybe chemicals, so that the communities can be able to treat because now the wells are for household use. So maybe we can now promote the use of household water treatment chemicals so that at least we ensure that the water is safe. And maybe once in a while, maybe what the government can do is maybe do random water quality checks within the household. Okay, thank you so much, and over.
Thank you, Rose, for that. We do have a follow-up question from Ruach, who asks, what are we preventing in the HAI and AMR in the health facility as a WASH expert?
Thank you so much. Yes, so in healthcare facilities, it has been found that, as I talked before, I said that it's been found that most of the infections happen within the healthcare facilities. So if we do not provide quality water, sanitation, and hygiene services within the health facility, we said that when a patient goes to the hospital, for example, sometimes they come out with another infection. Why? Because let's say, for example, in that healthcare facility, we are not providing water supply, maybe water for hand washing, or we don't have maybe alcohol-based rubs, for example, for healthcare workers. It means that they are able, a healthcare worker can transfer an infection from one person to another. And then we said also that when we have poor infection control practices within healthcare facilities, it means most of the microbes really, what we talked about antimicrobial, it means that some of the medications that are prescribed within a facility really are antimicrobials. But one of the ways that has been shown that if we have poor infection control, it means some of these microbes cannot they resist the current medication. So it needs maybe to change. Yeah. So in terms of antimicrobial resistance, we say that it is not entirely WASH, but WASH has it plays a role in terms of really contributing to antimicrobial resistance. So antimicrobial resistance has many causes. So one of the causes is maybe sometimes lack of hygiene and poor sanitation. It could be also that patients are not finishing their treatment, or sometimes it could be overuse of, it could be maybe over prescribing some of antibiotics. So antimicrobial resistance, it is caused by so many factors, but it has been shown that part of really the cause is also poor WASH practices within the healthcare facility. Okay, thank you, Nova.
Thank you, Rose. So in that line of water quality testing, we do have a question from Michael. And remember, participants, if you'd like to ask your question live during the webinar, kindly do raise your hand and we'll allow you to talk. So the question from Michael is, how often should we have to conduct water quality testing to be sure that communities are actually drinking safe water?
Thank you so much for the question. I would not say that we have a standard, but usually we can just say routine. It should be routine. So routine, I will not say that maybe every month, but it's usually important that we do routine water quality checks really, so that we know that our communities are having are consuming safe water. And you can also decide maybe to take sometimes maybe samples at the source. You can take samples at the distribution system, or you can take samples within households. However, when there is an outbreak, for example, for that now maybe you need to do maybe more frequent water quality tests. When there's an outbreak, but generally it's important really to do continuous or routine. So routine, you can say, for example, every quarter we should be doing a maybe water quality test, maybe within a certain area or within a certain region. But there are no really prescribed like times that you can do water quality. So sometimes it is dependent.
Thank you to Rose. And before I welcome Godfrey Caesar to ask his question, I do have a question from Kebede, who asks, what does that mean? That is when it comes to dignified wash services. So what does dignified wash services mean?
Okay, so let me attempt that. So when it talks about dignified wash services, let me just give an example. Let's say, for example, if I'm providing sanitation for a school. So sanitation for a school, when I talk about dignified, it means that each and every child should be able to access a sanitation service at the time, and they should be, let me call it, comfortable. So let's say, for example, I look at the school community and I find that that we have maybe children living with a disability. So I ensure like that sanitation facility should be able to accommodate that child. So I also ensure, for example, if I am in a school sanitation program and I am addressing maybe MHM, I ensure, for example, that I'm providing maybe a changing room for the girls or a bathroom for the girls. So that is ensuring that the needs for each maybe population or groups is addressed. That's what I would take in terms of dignified. So in terms also maybe for water supply, I ensure that maybe all people are able to access water, maybe within the desired, the desired distances, maybe we talk about 30 minutes walk or 30 minutes, 30 minutes going forth and coming to be able to access water. That's what I can call maybe dignified.
Thank you so much. And I see Godfred has actually put his question in the Q&A. So he asks, this is Caesar, how can household water like well be treated for use? Is the treatment chemical available on the market?
Thank you so much. So I think it depends on which country you're coming from, but I know there are usually water treatment chemicals that can be used in the market, which is mostly is chlorine. So we usually have the chlorine which is in maybe a liquid form. We also have chlorine that is in a solid form. So it really depends in the country where he is, and also the type, maybe the type that he wants to use. So it is available in the market.
Thank you so much for that. The last question before I actually do welcome Ruach Gach to ask his question in the interest of time would be from Mohammed. We do have a community forum and we will be answering these questions on the community forum because there are quite a number of questions, but in the interest of time, we'll take Mohammed's question and a question from Ruach. So Mohammed says, is it possible to have, let me see, to have a session on the impact of negative climate change on the rise of deaths in camps in areas with hot weather? So yes, Mohammed, it is possible. We are currently facilitating a climate change, not just a webinar, but a training as well. And we will be sure to invite you for that webinar as well. Remember, here at Humanitarian Global, we touch on very many areas, not just water and water sanitation and hygiene. We also touch on monitoring and evaluation restoration, disaster risk reduction management, project management, as well as now climate change as well. At this point, I do welcome Ruach to ask his question. Okay, seems Ruach is not able to ask the question at this particular time. However, remember, we have shared a link to our community forum. We encourage you to join the community forum. And from the community forum, we carry on these engagements, we carry on these conversations, the questions that have not been able to be answered today in the interest of time, we will be answering them in that community forum. At this point, I'd like to say a special thank you to our participants, our attendees who've been able to attend today's webinar. We really do appreciate you, especially those of us who've been quite engaging in terms of either sharing their details and taking interest in the courses, or even just asking questions in relation to today's topic in WASH. We do appreciate each one of you, and thank you for always attending these webinars. I'd like to take time to specially thank Rose Kandagor, our expert for the day. As you can see, she's very versatile when it comes to WASH and public health, and we do acknowledge her efforts as well as the knowledge that she's been able to share with us today and the skills that she's been able to impact on us when it comes to WASH and public health as well. I'd like to finally thank the Humanitarian Global team for enabling this webinar. Remember, we always have webinars every Wednesday, 11 to 12 p.m. Nairobi time. So we do encourage you to join our webinars. The next webinar will be next week on the 15th. It will actually be on a Tuesday this time round. So on the 15th of August, that is a Tuesday, and this one will be on cash and voucher assistance, and it will touch on the utilization of cash and voucher assistance in facilitating human aid. Our expert for that day will be Moses Onyach. So I encourage you, if you've not registered for that webinar, kindly do, and we look forward to meeting you come on the 15th, that is on Tuesday. With that, I do wish you a great rest of your day, and I hope to see you next time. Goodbye.
My name is Adam Mohammed. I am a humanitarian person and a farmer at the same time. I'm also a Nigerian. My journey as a humanitarian started sometimes around 2016 in the NYSC camp. You know, when you finish your degree program, you need to go for a year training. So in Nigeria, we call it NYSC, National Youth Service Corps. So while at the camp, I have this staff of KUSO International. KUSO International actually is a Canadian humanitarian organization that is working towards ensuring no poverty and no equality among the community in all. So they approached the serving corps members at the camp, telling them to come and volunteer with the organization in providing services in certain communities that they will be posted to. At first, I wasn't interested because I am a farmer. Then I realized that there are several areas where I can render my service to. I can also render my service to youths, encouraging them to have a sustainable means of livelihood in agriculture. There and then, I key in, I applied, I became a volunteer. So after volunteering with KUSO International, I then had the interest of working as a humanitarian person. I worked with KUSO International for a year, and thereafter I moved for my second degree studies, Masters in Agricultural Economics at Ahmed Bello University Zaria. So because of the distance of the place I was rendering the humanitarian service and the place I'm studying, I had to then resign from that particular role. Thereafter, while I was working, I was studying with at Ahmadu Bello University Zaria. Then I also had the opportunity to also volunteer with Action Against Hunger in Borno State. Because of the insurgency, the people in the IDP camp needed humanitarian service. Then I said to myself, I would volunteer to provide that service. After working with Action Against Hunger, thereafter I worked as a farm manager with Agro News Nigeria, and then here I am today working with FX Commodities Exchange, impacting life and providing humanitarian services to the humanity. While volunteering with KUSO International and Action Against Hunger, Feed the Future and all that on other short projects, I then developed that inherent, will I say, likeness of providing humanitarian services to the entire humanity. Then one day I was sitting on my laptop checking through online. Then I decided, I said, no, I need to look at some kind of humanitarian courses that I would attend so I can enhance my skills and my ability to deliver more in the humanitarian sector. So I went online and then I was searching there, and then I came across Humanitarian Global, and then immediately I signed up. I checked the programs that they have. I looked at one particular program that attracted my attention, which is Monitoring, Evaluation, Accountability and Learning, MEAL in short. So I then applied for MEAL program.